Ready to go, Aaron?
Yes, sir. Okay, let me.
Good morning. I'm Russell Myers, CEO of Midland Health, and this is the Unified Command Team briefing for Tuesday, April 28th. Across the state of Texas now we have over 25,000 confirmed cases of COVID-19. In Midland County there are 74, 663 deaths across the state and 5 in Midland County. At the hospital, we have been running a testing center, as you know, for some time. We've tested now over 1,500 cases. I'm really pleased with the results today. We're down to only 68 outstanding. The oldest of those is from Saturday, so we've done a pretty good job of catching up on test results. Hospital census is 120 this morning. We saw 88 patients in the emergency department yesterday. We have 10 patients in critical care, a total of 14 either COVID positive patients or patients under investigation, 5 of those in critical care and 9 of them in medical surgical environments. We have a total of 7 ventilators in use today out of our complement of 44. A little bit of news from around the hospital. We had two pieces of good news yesterday. We are beginning to see some breakthrough in the personal protective equipment supply chain. We were able to receive a significant shipment of N95 respirators yesterday and expect some more this week. We also are very fortunate to have received some of the in-house testing kits. We've had a great deal of difficulty getting those after a small initial allotment. We've had a much more significant allotment come through this week and expect a few more before the week is out. So we'll be improving our ability to do testing in-house. That means more rapid turnaround of tests, especially for those patients that are actually in the hospital, for employees who have exposures, for those cases that really need a rapid turnaround test. We've got some capability now to do that in-house. The Midland Medical Lodge situation continues to be monitored by our team. The update there is a total of 24 residents in the facility that are positive, 15 staff members, 9 of whom live in Midland County, 6 live in other counties around us. 7 of their patients are in the hospital at this point. 1 of those in critical care, 4 in our COVID med-surg unit, and 2 of them have been confirmed as negative and moved off the COVID units. So that's a fairly stable situation now, but we continue to monitor the situation at the Medical Lodge. I think the biggest topic today, and of course I'm sure the mayor will cover this in more detail, is the governor's report from yesterday on opening Texas. I'd like to emphasize a couple of things quickly. Number one, there's very little emphasis on hospitals in this report. The one thing of significance is that instead of reserving 25% of capacity for COVID patients, the governor has now asked hospitals to reserve 15% of capacity. We do not see that as a problem and expect to be able to comply with no difficulty. He did encourage physicians, dentists, nurse practitioners, and others to go back to work, to reopen their offices with careful social distancing and waiting room management policies, careful hygiene and disinfecting of the offices. I think I've told you a few days ago that we were working on plans and encouraging our own medical offices to do that beginning last week, along with our ramp up in elective cases. So we're slowly opening up the medical community. And once again, I'd like to encourage people, if you have a need to come to the emergency department, please do. If you believe you need to see your doctor, please call them and make arrangements for an appointment or a telehealth visit. We are making more and more of the health system available to people now as we begin to open up our community. The emphasis that I'd like to repeat, that the governor repeats over and over through the 60+ page booklet on opening Texas, is that social distancing expectations are not gone. In fact, as we reopen the society, we need to reinforce the need to wash hands, to disinfect surfaces, to maintain social distancing, to respect the governor's expectation that businesses, as they reopen at much reduced capacity, from their norm, that we continue to maintain that social distance throughout all of our experience in retail or restaurants or movie theaters or wherever we go. You'll continue to hear that from us at the hospital. We're not changing our visiting expectations. We're not changing the expectations we have of our employees to wear masks. We're still asking people, if they come into the hospital, to go to the emergency department, to come for an outpatient test or procedure, wear a mask from the moment you come in the door. We're going to continue to emphasize all of that and repeat over and over what has worked so far and will continue to work, which is respect for those social distancing and hygiene guidelines. So with that, I'll end my remarks, take any questions you have for me, and then I'll call on Dr. Wilson for some brief remarks as well. Any questions?
Still waiting to see if any media questions pop up. Tasa, do you have any Facebook questions?
Questions at the moment, Aaron.
Okay, we'll go in just a few seconds, Russell.
Okay, all right.
Okay, you can turn it over to Dr. Wilson.
Okay, Dr. Wilson.
Thank you, Russell. So, good morning, everybody. I'd like to just start by giving a little perspective on current state. There's been a lot of fluidity changes that's been going on with the situation as we've moved forward and begin to think about opening up the economy and move things forward in the state, as the governor has spoken about. I wanted to start off talking a little bit about the testing that's been going on, because there's been increasing conversation around the antibody testing and the availability of that. I think the president's been speaking about making widely available testing in states to test 2% of the populations. And the question being, which test is that to test for active disease, or is that for the antibody testing? We'll see how that moves forward. But the current state is that there is antibody testing becoming available. I think there are some primary care doctors and others in the community that are beginning to use some testing. There's a lot of different kind of tests out there, and I've spoken about, and I think others have, that they're not really quite at prime readiness yet. This has been really rushed to market. This has been developing over 3 or 4 months. Usually takes years to develop this very specific, well-defined antibody test. So currently, what we do know is that there are tests that are coming out. There's probably 3 or 4 that are going to be what are considered best of breed, and these are going to be generally tests that can be done through a laboratory and sent off for management, rather than what we call the point of care testing, which tends to be a little bit less reliable in general. But of those tests, what they can show is antibody development, and whether that be an initial response or if it's actually a neutralizing antibody to actually kill the virus still isn't known. We don't know if this is really going to show immunity or not, and that's a very important component to what we really want to answer. Another part is that the antibody tests can look for a variety of different antigens on the surface of the virus. And as you know, there's a number of different coronaviruses. So whether it's specific for just the SARS-CoV-2 or for other viruses as well of the corona family or others isn't well recognized. So even amongst some of the best of breed right now, the specificity is about 95%, meaning if you take 100 people and test them, 5 of those people will test positive and have something else going on rather than the coronavirus that we're looking for specifically. So recognizing all that, please be careful as you look toward doctors that are offering or others that are offering you an antibody test, to recognize that it's going to take some time to really understand what that test is telling us about the virus. A second thing to remember is that is the antibody testing, and what we've been doing largely through our drive-through testing here and at the hospital has currently been a PCR test, or a test looking for just the RNA of the virus that's active in the individual. There have been tests that have some studies that have been done that have looked at the antibodies and shown that antibodies are in individuals, but at the same time, they have RNA still that they're shedding. So we've got to be cautious about whether or not having antibodies indicates that you no longer are shedding virus. So please let's be careful about that as we move forward as well. Finally, I want to touch back on the therapies that you've heard about and that we've been utilizing, and just mention that we still don't have a best of breed out there. The hydroxychloroquine still is being used widely in many places, not as more selectively here of late. There's some anti-cytokine drugs on the market as well that we're using in some circumstances here. And probably the most promising continues to be the serum plasma therapy. So let's hope that that continues to be a successful therapy, and we continue to have the slow burn, the mellowing of the disease in our community, and hope that we can open up the economy and get things moving in a positive way sooner than later. I want to just reiterate finally something that I heard the governor say yesterday that I think is really important, that we still have to remember that the virus is still here as we begin to open things up. The social distancing, wearing the mask. As we open things up and we have 25% occupancy in buildings, people are going to be closer together. The mask mitigates that. It spreads the distance. If you're 3 feet apart, it'll be more like you're 6 feet apart in relative terms. So wear the mask, please, to protect those around you from any potential virus exposure. He also emphasized the importance of making sure that we continue to protect the aged and the vulnerable. We can open up the economy and get young people and those people that are at less risk back to activity and doing things to get the economy going. But if we expose the elderly, this is going to be a problem again, just like we've seen in some of the long-term care facilities across the country and even here in Midland. So please, let's remain cautious about that. He also mentioned, let's rely on the science and let's rely on the data. That's why the testing becomes more important. Getting reliable tests becomes more important. We have that information. We can begin to make smart decisions about the way we do things and do it in a measured fashion to avoid other outbreaks. Suspect things will kind of quiet down through the summer months. The hot, dry weather will probably help, but we still have a fall coming up. We have to be prepared and manage that as well as we can. And his final point, I think, was the one that resonates with all of us very much is let's get back to doing things. Let's get back to being active and get the economy moving. But please, let's do it in a measured fashion. Please, let's remember the social distancing as we move forward. So thank you. Oh, any questions?
Okay, we'll give them just a few seconds. All right,
Okay,
Dr. Wilson, thank you. Whitney Craig.
Good morning. I will start off with the breakdown of the case demographics, and then we'll pause for any questions. Our total confirmed cases as of right now are 74. Sources of exposure are 16 travel-related, 49 contact to a known case, 9 with community transmission, and 0 still under investigation. As far as gender, there are 28 male and 46 female. For our age groups, we have 7 that are 0 to 19, 17 that are 20 to 29, 10 that are 30 to 39, 6 that are 40 to 49, 10 that are 50 to 59, 3 that are 60 to 69, 10, 70 to 79, and 11 are 80 and above. For patient status, there are 5 that are in the hospital, 16 in a nursing or rehab facility, 20 that are home isolating, 3 that have completed their isolation, 25 as recovered, and 5 that are deceased. For medical visit, we have 23 that were tested through the drive-through, 12 at a clinic or provider, 6 in the emergency room, 13 that are tested as inpatients, 20 in a congregate facility, and as far as investigation status, 52 are ongoing and 22 are complete. I'll pause for any questions that anybody might have on any of that.
Okay, Mitch from Marfa Public Radio asks, could you break down which counties the COVID-19 positive staff members from the Midland Medical Lodge are from?
As of right now, there are 15 that are positive. 9 would be from Midland, and then we have 4 for Ector and 1 in Howard.
You said Ector, what was the second one you cut out?
1 in Dawson and then 1 in Howard.
Okay. I know Jacob had a question. So Jacob, do you want to type your question in the chat?
Should I type it or should I just
Oh, you can ask it.
Okay. Hey, Whitney, this is Jacob from CBS 7.
Jacob.
Hoping that you saw the report from the MRT yesterday about kind of a history that Midland Medical Lodge has with being cited for various health and care violations, and then also not having implemented an infection control program in the past. I just want to know if you guys knew about that and kind of what your take is on that.
No, we wouldn't know about their infection control policies within their facility. When we do our inspections, it is strictly to the kitchen. So the state takes care of the rest of the facility. I am currently aware that the Texas Health and Human Services Commission has been on site since the 17th. So they are working with them in regards to their current infection control policy and any modifications that would need to be made going forward. I'm not sure if that answers your question, but
I think it does. Do you
okay.
see maybe any correlation with kind of this, what appears to be a track record now, and what is a severe outbreak there that's making up a third of Midland's cases?
That's a good question. What their policies in place and their actions that they take in regards to following or not following their policies are going to have an impact, especially with something as transmissible as COVID. So we're lucky that the state is actually present on site to be able to do that monitoring to see what is working, what isn't working, and again, what needs to be modified.
Okay, and then I think maybe one more question from me here, and we'll let somebody else have the floor. The hospital kind of mentioned that situation's stabilizing. What can we expect here going forward numbers-wise? Are we going to keep having another positive case or two every day, or is it gonna slow down, or what do you think we'll see there from numbers coming out of the lodge?
Well, it's actually hard to tell, especially in our community. That'd be almost the same as me saying, are we going to have, how many are we going to have community-wide? It's going to depend on what they have in place and what the testing results look like. As we know, some people are starting to test positive and yet they are asymptomatic, or we're having people that are developing symptoms later after testing. So when it comes to the lodge in particular, we just want to make sure we are monitoring that locally and at a state level to see that those that need to get tested are getting tested. Regardless if you've been tested already, if you do develop symptoms, the testing needs to occur. So yes, my hope is that we do see this taper off, but I won't go on record saying that that's what's going to happen.
Okay, thank you.
No problem, thank you.
And then we have a few more questions from Mitch. The hospital, this is his words. The hospital, I believe, stated there were 16 positive staff members. Are you 100% on those numbers? And how many staff members initially tested negative for the coronavirus that have now tested positive? Yesterday, MMH stated at least one staff member had tested negative, but was then diagnosed with COVID-19.
To my knowledge, we are at 15% or 15 staff members for the lodge. And in regards to staff members testing negative and then testing positive, I believe we have one. So yeah, I'd confirm what MMH said about that.
And then from the MRT, Stewart asks, is it concerning from the health department's point of view that so many staff members have tested positive? Do lodge officials have any explanation for the reason for the number of staff members testing positive?
I think it's of concern when anybody tests positive. It's not something that I enjoy seeing or having to report that we're getting more positives. And for them to be in one location, it's something that we are keeping our eye on. And luckily, as I stated before, the state is on site. They have been on site since the 17th, and I have been in communication with HHSC. So they are having their surveyors do what they need to do, and I'll be able to find out their findings afterwards. As far as the lodge officials and their explanation, we know this is a highly transmissible virus, and per what I've been told from HHSC, they are doing well in regards to their PPE usage. So in regards to the officials, I'm sure they believe they're doing everything possible to prevent and mitigate the spread. HHS even said as much, that they are under the impression that the lodge is doing everything in their power to mitigate the spread. So I think when it comes to continually having positive staff and continually having positive residents, I'm sure they're just as worried and concerned as the rest of us in regards to how they feel, and an explanation you would need to follow up further with the lodge.
And then we have a question. The person from Howard County that works there that works in the Midland Lodge, is that number added to the Midland numbers or the Howard County numbers?
That's a Howard County case.
All right, we'll go in just a few more seconds to see if there's any others. Okay, this will be our last one since we do have city council today. We're gonna kind of move through this. This is from Sammy Steele. She said, a source at the lodge has told me that MML staff is receiving infection control in-service training. All MML staff is not allowed to care for residents in the facility until they fully understand the infection control policy. Is the health department aware of these changes? If so, can you elaborate? I've reached out to the lodge about this and they have not replied.
I'm sorry, Sammy, that you hadn't been able to get a reply, but we were not made aware of their in-service training. I'm not sure if that's something that is provided by the lodge itself or if it's being provided by HHSC because they are on site. So I wouldn't be able to speak on that anymore.
Okay. Thank you, Whitney.
Thank you. Have a good day.
You too.
Thank you.
At this time, we will turn over to MISD. Katie, you're good to go.
All right. Hi, I'm Katie Atkins, Chief of Staff, Midland ISD, and a couple of updates from the district. So as has been mentioned previously on this press conference, Governor Abbott has outlined his approach to opening the economy yesterday. We want people to still understand, though, that schools still remain closed. So his prior executive order is still in effect regarding the closure of Texas schools throughout the end of this school year. We're continuing to move ahead with our plans for alternative graduation celebration. Information will be coming from our campuses to parents and students very, very soon. But in addition to that, we were looking for other opportunities to honor our seniors. We realize this has been a very unusual situation for them. So we want to provide the graduation celebration that will be in a alternative fashion, while also entertaining other possibilities for when social distancing restrictions are completely lifted. So we're looking towards reviewing those feedback, and we're receiving quite a bit of feedback from family members, seniors themselves on what this could possibly look like. So we've stood up a form on midlandisd.net/seniors2020, and that is a way to collect some feedback. We're reviewing that, and there's so many great ways that we can look at to move forward with some alternative opportunities once the socially distancing has been lifted. We also want to share some things that we are doing in Midland ISD to make sure that we are minimizing and not spreading COVID and moving forward with flattening the curve. So in addition to schools being closed, when our staff is on campus, and I know we're still closed, but sometimes we might have custodians who will have others coming up to do some essential functions in the buildings. We certainly emphasize hand washing, making hand sanitizer if that's available. We have been making masks available to our staff and carefully vetting our staff who are coming into a building. We certainly don't want anyone coming in if they are not feeling well, and we want those people to stay home, as has been shared previously. We are currently formulating plans for our staff and our families to be able to retrieve those belongings that were left in classrooms and move forward with closing down the schools physically for the end of the school year. Those plans are being devised by our campus and principals in consultation with our health director of health services, our campus executive directors, and viewing that through a number of lenses. And so those plans will be shared with parents and students and teachers very, very soon. So we're in the process of making those plans, and those will be coming out very, very soon. I also want to remind everyone listening that registration and enrollment is currently underway. All new and returning students must register. This is how it's always been in the past, but we just want to make everyone aware of that and remind them. Please visit midlandisd.net/enrollment to get started. You can register your kindergarten student online. And then moving forward with pre-K, we've had a lot of questions about pre-K. We're moving pre-K now to an online platform as well. That is coming soon, and that will be shared once that is available. We realize that is a tremendous shift in our pre-K registration, and the team that's been working towards making that possible, we're grateful to them for working towards that. So that information will be coming very, very soon. With that, I will go ahead and take any questions from Midland ISD.
All right, Katie, let me just see if anyone has any to ask. From the hospital's Facebook, they ask, please speak to the summer learning for students.
Right. So we will, as always, there's always summer learning opportunities. We're looking through a number of ways for students who are currently needing some further support moving into the next school year. We'll be reaching out to those students. We're looking at what they have done prior to COVID, and now during this time where we've been in closure and we've been doing the progress monitoring. So we're looking at all of that data to provide students further summer learning opportunities for support. We also want to look at it from the opportunity as enrichment for students who have been doing just fine, but they want to have something more. And so we want to make sure that we're providing that on a number of platforms as well. So that information will be forthcoming as well. Our teaching and learning staff is in the process of developing what that looks like and continuing to receive feedback from the state on other opportunities that they have stood up as well. And so we're excited about what that's going to look like, and that's going to be coming out to parents soon.
Another Facebook question says, once we register, will our new school show?
Once you register, will your new school show? So there are a number of things. So if you are applying for a transfer sort of situation where you are you want to go to a school of choice, we have a number of schools of choice. You first apply through Apply Midland, and that's a way to get your express your interest there. And then following that would be the Skyward registration. I don't know if that answers the question, but please reach out to our check onto midlandisd.net/enrollment. That walks you through the steps. I want to make sure that we're responding to that. And there's also some numbers that are stood up there if you need to speak directly to someone about a particular question. If I'm answering that, but I also want to give people opportunity to chat with someone who can answer their question further.
And the next question was, how do we go about a transfer if needed? Is that by visiting that same website?
Yes, please move forward with that. And Apply Midland is where you would initiate that.
All right, that's all we have. Thank you, Katie.
Thank you.
At this time, we will Judge Johnson or Justin. I'm not sure which one of you wants to go first. Justin?
Probably, yeah, the judge isn't going to talk today.
Okay.
So Justin Bunch, Midland County Emergency Management. I just want to hit on a couple things. The first thing is we are going to have a mobile testing May 3rd, from 9 a.m. to 5 p.m. at Greenwood Volunteer Fire Station, and that address is 3103 FM 1379. And this mobile testing will be coordinated through the state with Texas Military Department soldiers actually doing the testing. In order to get scheduled for the testing, you'll need to either go online to register 24 hours in advance or call 512-883-2400. And I've also got a flyer that I can send out to the news folks here if they want to send me their email addresses. I've got it in English and Spanish. So again, this is something that's done by the state and the Texas Military Department. It's not through the county. How we got involved is they were going to offer it to another local or outlying county, but it fell through, and so they contacted us and asked if we could assist them. So we jumped at the opportunity and got with Greenwood, and they offered to host it at their facility. And one of the reasons why we're doing it out in Greenwood is because Glasscock County, Reagan County, and Upton County at this time don't have mobile testing, and so we put it out in that location to give them a closer access to that testing facility. But again, you will have to call and make an appointment. There is no show up and get a test. You've got to have that appointment. The last thing I wanted to talk about is just ask everybody to continue using the chat texting app that we've got. That's really given us some good information, and we would really like the community to continue using that. Other than that, are there any questions?
MRT is asking, do we have an update on chat numbers?
I do not. Judge Johnson may have some updated numbers. I don't have those numbers with me now. I'm not sure which county. I'd like I said, the Texas Division of Emergency Management just gave me a call and said that they had one fall through, or for some reason one county couldn't provide a location. So like I said, they asked us, and we jumped on the opportunity to help them out.
Okay, we'll go in just a few more seconds, Justin.
And here in a second, I can probably look at those chat numbers and provide them in the message box if that'll help out.
Okay, that'll be perfect. Thank you.
Thank you.
Mayor Payton.
Good morning, everybody. And as has already been mentioned, I think in just about every presentation from every entity that the governor's press conference yesterday is the news of interest as well. We want to thank everybody again, as we've been thanking everybody with every press conference, for everything you've been doing here in Midland, all the things you've been practicing, and how patient you have been as we've been going through this process. A couple of things related to what the governor expressed yesterday, and then really just kind of the steps that we're taking. As everyone is aware, it's a staged process to reopen the Texas economy. We are working together as a city council today. I'm sure we'll be discussing this issue. I have some meetings this afternoon with other members that are on this Zoom call this morning. As we begin to digest what it's going to mean for us, let's be very clear. It's very important that if you're a local business, that you go to the City of Midland website, you go to my Facebook page. I'm sure it's all over everywhere now. You can go to Governor Abbott's website. You really do need to familiarize yourself with the document that is already up on the website for you to see what the rules are and the regulations. Everything that Governor Abbott has put forth really trumps everything that we would say as a city. So the declaration that we've put forth and all these different things that have been in place both by the city and by the governor, those are done away with come Thursday. And so when we get to Friday, the rules that we abide by are the ones that have been set by the state and by the governor. That brings me back to why it's so important for you as an individual to be going to these various places on the internet and reading the sections that apply to your business. If you're a restaurant, what are the things that are suggested that you do, and so on and so forth, whether it's a movie theater or other issues. We continue to get some information from many of you out there about hair salons, about gyms, and different things that were excluded from the governor's order. And there's continuing work being done on that this week. I'm not making a promise as to whether that is going to change, but be paying attention as we're still about 3 days away from things beginning to turn around. I do want to also emphasize the fact that we must be cautious and conscientious as we go through this. Given our human nature, since we've sort of been held down for a very long time now, there's a tendency not to hear that this is a staged opening. In other words, this is a 25% of occupancy. If you are a business, you are aware that 25% of occupancy is not the occupancy you desire, but the occupancy as it is given to you by the city and as you have as your occupancy max. And so it's 25% of that. So as we begin to go through this process, find out the areas in the governor's document that apply to your business and the type of business you have. There's checklists there. There's all kinds of safe practices you can go by and you can abide by. and be ready for that. But we must be cautious and conscientious because, as again, our human nature, we have been tied down, we're ready to get out. And sometimes we don't even want to pay attention to anything that restricts us anymore. And we just have to go about this safely. We have to go about this cautiously. We have to go about this conscientiously. And as has been talked about by the governor, and we are talking about as well, once things open up on May the 1st, then there will be about a 2-week period before we can go to phase 2, which is a 50% of occupancy. That is going to be based on testing. It's going to be based upon what we see as far as our numbers are concerned with the COVID-19. And so we're going to be watching it very closely. So you've done a great job as a community, doing everything that you have been asked, going above and beyond. Just continue to do the things that you're being asked, going above and beyond, so we can eventually get to the beginning of summer, maybe mid-June, and have our economy be up and running again. So with that, Aaron, I'll take any questions.
The first one comes from News West 9. They ask, how are you going to regulate businesses being at 25% occupancy?
Well, we're not going to run around the city and run in every door and see if they are abiding by that or not. We're going to do what we've done for the last 4 weeks plus. We're going to rely on the good nature and the conscience of those who are in business, and also consumers who would realize that a business would put more people at danger than they have to and no longer take their business there. That's what we mean by a free market economy, and by consumers being able to determine their safety. I firmly believe that if restaurants and businesses don't continue to take care of people's safety, then people are going to know that, and people aren't going to frequent that business. But we're not going to have our police on patrol for the 25% patrol, so to speak. And if things are fairly similar to what they've been like over the last month, I'm sure we'll get multiple emails from people who will be telling us who's not abiding by those rules.
The next question comes from Mitch. He says, the hospital and other local health officials say wearing a cloth mask, which is recommended by the CDC, is key to controlling the spread as the economy opens up. When I'm out and about, I do not see the majority of Midlanders wearing face coverings. How can or is the city going to motivate residents to wear a mask?
Good question. We're going to continue to encourage people to do that. We are not going to mandate that. We're not going to make that a law that we're going to walk around and fine people who don't have their masks on in public. But all we can do, Mitch, is continue to encourage people to do that. And if they believe that's in their best interest and in the best interest of their neighbor, they're going to begin to practice that as they see fit and as they see necessary.
And the next question is, as restaurants reopen, can they thrive at 25% or can they still struggle? Could other businesses thrive or struggle at 25%?
That's only a question each business can answer. I know there are some restaurants that probably will not fully open at 25%. They'll wait until we get to the 50%. And there'll be businesses that are going to be the same, but it's going to depend on each and every business model and how they're able to make things work in their particular business model.
All right, we'll give them just a few more seconds to see if they have anything else. Okay. Do restaurant staff have to wear face masks?
There are guidelines within the governor's orders, and I believe that there are recommendations in there for servers and staff to be wearing gloves and face masks. I'm not 100% certain, but that's going to go back to the fact that people, and especially restaurateurs, are going to need to check those regulations and those suggestions as they go into the opening process.
How is the city preparing for a scenario where the governor instates another lockdown if case numbers begin to rise?
Well, first of all, we'll do exactly what we've been doing. I think we're even more ready for something to have to be put on pause because we see a rise in cases. Our hospital is more prepared. Our health department is more prepared. Our city is more prepared. Our county is more prepared because we've learned from experience over the last 4 weeks plus. So if they have to put the brakes on, I would anticipate they would not close everything down. That is a guess, but they would try to see if we could stabilize at this 25% phase 1 and then see if we could make another move after that. Because at some point we're going to have to figure out how to stabilize at particular areas of growth, or we're just going to get into a position where we're just going to drive everybody out of business. And then there'll be more stuff from the federal government as far as money is concerned, which we're already deeply, deeply in the hole. So we're just going to have to watch it. And I think we'll be more ready than we have been in the past, and we'll be ready to handle it.
All right, let me see if any others come through. Mayor Payton, thank you.
Thank you. Thank you to everybody. Have a good day.
Bye.